Today I will try to explain stroke. Basically, what is stroke? Stroke is a common medical emergency. It is commoner with increasing age, greater poverty, and with vascular risk factors. What are the types of stroke? There is ischemic stroke and there is hemorrhagic stroke. Okay? The ischemic stroke, which caused by a blockage or clot in a blood vessel that's supplying the brain. And I will explain the anatomy of the blood vessels of the brain. And ischemic stroke counts for 85% of total strokes. The second type is hemorrhagic stroke, which caused by bleeding into the brain due to ruptured blood vessel. And this counts for 15%, approximately quarter of the strokes total amount. That's mean when we have a clot within a blood vessel, blockage or clot in the blood vessels that's supplying the brain, this will result in decreasing the amount of blood into the brain. In both types of stroke, the result is a decrease in the blood supply and a blood perfusion into the brain. Okay? Whether there's something block the pathway of the bloodstream, or within there is no blood, there is a ruptured vessel. So there is no blood to this specific area, and now we will know more about these areas. Okay, so this is the anatomy of the blood vessels of the brain. Here shows these blood vessels. So here, from the arch of aorta, there is the brachiocephalic artery. And this is the left common carotid artery. And this is the right common carotid artery. When we ascend more in this pathway here, this is the internal carotid artery. And just to try to keep the name and the location of internal carotid artery, because it's important and we will know. Both right and left common carotid arteries ascend, and here the right common carotid artery will give two branches: external carotid artery and internal carotid artery, which is most important because this goes directly to the brain, while this goes to the face and muscles of expression. Also, the left common carotid artery will give two branches: the external carotid artery and the internal carotid artery, which is the most important. Okay, now the internal carotid artery will ascend upward, and here it will gives a branch which is middle cerebral artery, and gives branch here which is the posterior communicating artery. Anteriorly, here there is anterior communicating artery. So the posterior communicating artery, the anterior communicating artery, and the middle cerebral artery. As we go here, there is a branch which is anterior cerebral artery. So in this pathway, and the same for the left common carotid artery, the left internal carotid artery. Both of these left and right common internal carotid artery and their branches will form circle of Wills. Okay, so the important branches that we have to keep them, because if there's a blockage within them, this will result in stroke and important symptoms. The anterior cerebral artery, it's important if there's a clot or something, rupture. The middle cerebral artery and the internal carotid artery. This is for the anterior circulation. What about the posterior circulation, which also contribute in this circle of Wills? Here from the left, subclavian artery, there is a branch which call it left vertebral artery. the left and right will give these vertebral arteries, which they unite here to form the basilar artery, which is also important. Basilar artery, if it was occluded or a bleeding occurred within it, also this will result in a massive disaster for the body. Okay, so the basilar artery also ascends and it will give branches for the structures and organs on its root. So it will give anterior inferior cerebellar artery for the cerebellum. It will give also for both directions. Superior cerebellar artery and posterior cerebellar artery, and will unite with the posterior communicating artery, and it will communicate with the posterior communicating artery, which is a branch from the internal carotid artery. Okay, and now the circle of Wills is completed. Okay, so this is the basal anatomy about the blood vessel and blood supply of the brain. Okay, now let's have some knowledge about the areas that this artery, I told you, anterior cerebral artery, mid cerebral artery, and posterior cerebral artery, and basilar artery, and vertebral arteries, and the areas that these vessels supply. So here, anterior cerebral artery supplies the medial surface of both frontal lobe and parietal lobe. The anterior cerebral artery supplies the medial surface of the frontal and parietal lobes, okay? While the middle cerebral artery supplies the lateral surface of of a frontal and parietal lobe, in addition to the upper portion of temporal lobe. And the posterior cerebral artery supplies the occipital lobe and the lower part of the temporal lobe, in addition to the thalamus. If you look deep in the brain, in the subcortex of the brain, there are lenticular striate arteries, which are a branch of middle cerebral artery. Here in the circulation, the middle cerebral artery will give lenticulostriate arteries, okay, for the subcortex of the brain, which also supplies the basal ganglia. And you know, basal ganglia are cluster of subcortical nuclei which are located deep in the cerebral hemispheres. The largest component of the basal ganglia is the corpus striatum, which contains caudate and lenticular nuclei, which are the putamen, globus pallidus, externus, and internus, the subthalamic nucleus, and the substantia nigra. This is the basal ganglia. Okay, so you know that the primary motor cortex located within the frontal lobe and the cortex, the frontal lobe here. This is the frontal lobe. There is a primary motor cortex, which is responsible for the movement of muscle contralateral and the other side, muscle movement. And the medial side of the frontal lobe, primary motor cortex, controls by the anterior cerebral artery, okay? The medial side of the frontal lobe, primary motor cortex, controls the muscle of the leg, while the lateral surface of the cortex and the frontal lobe controls the muscles of the arms and face, okay? The medial surface supplied by anterior cerebral artery, while the lateral surface is supplied by middle cerebral artery. So if there's a problem within the anterior surface artery, which supplies the medial side of the frontal and parietal lobe, this will affect on the movement of the leg contralateral side, both sensory and also and you know that the primary sensory cortex located within the parietal lobe and medial parietal lobe responsible for the sensory of contralateral side. You understand? So if there's a problem in this artery that supplies the medial side of the frontal and parietal lobe, This will affect on the leg of contralateral side from two sides. By effect on movement, this will affect on movement and sensory feeling of the contralateral leg. Also, it will affect on the arms and face of the contralateral, but not in the same degree of the leg. The leg is larger. Okay. Now we will see the symptoms. Okay. The parietal lobe, where primary sensory motor cortex located, also works with the same mechanism of the primary motor cortex. The medial parietal lobe, responsible for sensory of the legs, which is supplied by anterior cerebral artery. The lateral parietal lobe, responsible for the sensory of arm and face, which is supplied by the middle cerebral artery. What about the basilar artery? The basilar artery supplies the pons and superior, anterior, and inferior aspects of the cerebellum. The vertebral artery supplies the medulla and posterior and inferior aspect of the cerebellum. Now we will know the differences between transient ischemic attack and acute ischemic stroke. Transient ischemic attack occur when there is no infarction. There is only a blockage of the bloodstream. Okay? And the neurodeficit symptoms lasts less than 24 hours. It's a transient, not permanent, temporary, okay? It looks like stable angina. While acute ischemic stroke, no, it's an infarction. There is infarction. And the neurodeficit symptoms last more than 24 hours and maybe never last. Okay. Now, what are the causes of stroke? There is the first cause is hypoxia, embolus, thrombosis. Okay? Hypoxia happen whenever the patient, have a massive decrease in the blood supply to the brain. Thereby, there is a massive decrease in O2 to the brain. And this happen in some cases such as cardiac arrest or shock, which is septic shock, cardiogenic shock. Okay? This is for hypoxia. What about the thrombosis? Thrombosis, which occurs when a piece breaks from a clot and it travels into one of the arteries in the brain and is stuck there within this artery. It is either cardiogenic, which is manufactured by the heart, such as atrial fibrillation. You know, when there is atrial fibrillation, there is no contraction of the atrium, so the blood will stay there, accumulate there, and thereby there is a clot formation. Or from DVT that pass from right atrium into left atrium through an interatrial defect, which is called patent foraminovalle, then into the aorta, then internal carotid artery, and this is called paradoxic embolus. Okay, what about embolus? It occurs when there are a blockage within small vessel, such as lenticulostriate arteries, or large vessels, such as internal carotid artery or vertebral artery or basilar artery, middle cerebral artery. And these vessels, usually these plaques are accumulate. The plaques are ruptured or fissured, leads to formation of a clot, then occlusion of this blood flow, which was a small vessel or large vessel. Okay, here, as we know, it's a coronary view of the brain. This is the medial surface of the parietal or frontal lobe, which supplies the leg. Okay, this is the leg. While here, the lateral surface supplies the face and arm. This surface is supplied by anterior cerebral artery, and this surface supplied by what? Supplied by the middle cerebral artery. So any problem or stroke or rupture or bleeding within the anterior cerebral artery will result in weakness in the leg, and any problem or blockage or stroke or bleeding within the middle cerebral artery will result in problem within the face and arm. Okay. Now, before we heading into the symptoms of ischemia and stroke of these arteries, let's read some functions of these lobes from Davidson. Frontal lobe, responsible for contralateral motor cortex, personality, language maturation, emotional control, generally for execution. Okay? So any problem will result in contralateral hemiparesis, which means paralysis or weakness. Weakness, this is for motor. This will result for weakness of the contralateral, for the leg of the opposite side. Okay? And here for parietal lobe, there is dominant and non-dominant lobes. Generally, the dominant responsible for language, calculation, and the sensory control of the contralateral side of this part. If it was medial parietal lobe, this is responsible for the leg. If it was the lateral surface of the parietal lobe, this is responsible for the sensory of the face and upper extremities. Okay. So any problem within the parietal lobe, this will result in contralateral hemisensory lobes. Means ability to control the sensation of the leg or the face or the arms. Okay. Occipital lobe responsible for visual processing. So any problem within this lobe will result in homonymous heminopia. Okay. Now, let's talk about the symptoms of anterior cerebral artery ischemia. And we mean here by ischemia whether it was a blockage or occlusion in the blood vessel by clot or thrombus, or whether it was by decreased the blood supply, such as in cardiogenic shock or septic shock, as we talked previously. So anterior cerebral artery stroke or ischemia will result in more weakness on the contralateral leg, in addition to loss of sensory on the contralateral leg and less extent into the contralateral arm and face. So the main part will affect here in anterior cerebral artery here, as we said. The anterior cerebral artery supplies this area, which is responsible for supplying the leg, whether it was motor or sensory. Okay, so the leg will be affected more than the face and arm. Okay, both sensory and motor. This is for anterior cerebral artery. In addition, there is apraxia. Apraxia, what is apraxia? Apraxia here, it's inability to perform complex movement in the presence of normal motor, sensory, and vestibular function. So inability to perform complex movement. Incontinence, because here there is a micturition center within the frontal lobe. So if there is a problem within the frontal lobe by decreasing its blood supply here, this will result in incontinence. The micturition center affected. Dysarthria and aphasia. The middle cerebral artery has two divisions: the superior middle cerebral artery and inferior middle cerebral artery. Was here. The middle cerebral artery has the superior and inferior middle cerebral artery branches, and they have totally different symptoms. As we said, the middle cerebral artery supplies the lateral surface of the parietal and frontal lobe, and this parietal and the lateral surface of parietal and frontal lobe responsible for the sensory and motor of the face and arm. So any problem within the middle cerebral artery will result in a problem within the face and arm motor and sensory. Okay, so if there is a problem in the superior middle cerebral artery, there will be contralateral hemiparesis affecting the face, as we said, and the upper extremities, the arms, more than the legs. The legs will be affected, but at least extent, not like the anterior cerebral artery, okay? There is contralateral hemisensory loss also, on the same manner, for the face and upper extremities, sensory affected more than the legs. There is ipsilateral eye gaze, means when there is a problem, both eyes will look at the site of lesion. The superior middle cerebral artery also causes expressive aphasia, if this was a dominant hemisphere. And expressive aphasia occurs because if a Broca's area, which is responsible for speech prediction, located on inferior frontal gyrus on the lateral surface, and this is supplied by middle cerebral artery. So Broca's area will be affected, and then the person cannot produce the speech, so there will be an expressive aphasia, okay? What about inferior middle cerebral artery? They are different completely from superior division. There is no control on the sensory end. This is responsible for contralateral visual field deficit, which is called heminomus heminopia, meaning it loses the visual field of the opposite side. If it was a dominant, the inferior middle cerebral artery, if it was a dominant, there will be a receptive aphasia. And receptive aphasia occurs when Wernicke's area, which is located within the dominant hemisphere of the posterior portion of the superior temporal lobe, and this supplied by the inferior middle cerebral artery and responsible for understanding the meaning of the words. If there is a problem within the inferior middle cerebral artery, there will be a problem in understanding the words, and thereby there is a receptive aphasia. There is also a non-dominant hemisphere. There is a behavioral change, which is usually they diagnose it as a psychiatric disorder, and it's not. It's a inferior middle cerebral artery stroke. And also there is an impairment of visual low spatial skills, such as addressing, drawing, and etc. The internal carotid artery stroke. It could be asymptomatic due to collateral vessels that form, so they just provide the deficit in this blood supply. Or if there is no collaterals, it could be as a transient monoocular blindness, which is called amaurosis fugax. Anterior cerebral artery stroke and symptoms, and middle cerebral artery symptoms. What about the posterior artery stroke? As we know, posterior artery supplies the occipital lobe, which is responsible for visualization. So there will be a contralateral heminomus heminopia with macular sparing because, as we know, the macula is supplied by the middle cerebral artery and the posterior cerebral artery. So if there is a problem within the posterior cerebral artery, the middle cerebral artery still works, so half of the macula will still. There will be a visual anosognosia. That means he or she doesn't know that she doesn't see. Agnosia, which means inability to recognize familiar objectives. Prosopagnosia, which means inability to recognize familiar faces. This is useful if we have a case here as a question, and they told you that there is a contralateral heminomus heminopia with macular sparing. There is agnosia, and this is posterior cerebral artery. What about lacunar stroke? Lacunar stroke or infarction means subcortical lesion with a size less than 15 mm in diameter, caused by occlusion of penetrating artery from a large cerebral artery. The clinical feature and physical exam finding of lacunar syndromes are characteristic of the type of lacunar syndrome. There is pure motor stroke and the pure sensory stroke of the contralateral side. There is mixed sensory motor stroke. There is ataxic hemiparesis, weakness and loss of the coordination. There is dysarthria, clumsy hand syndrome. All these symptoms are useful in the cases if we have, we as a last year medical students, this is useful for us because there are lots of cases in the exams. Okay, basilar artery tract. This is the basilar artery here. This is the basilar artery. Which supplies the pons and parts of the cerebellum, or call it Lockedon syndrome. It's rare disorder, and thanks God, this is fortunately rare because the patient here paralyzed, except for the muscles that control the eye movement. And he is conscious, aware, and he can think and reason but cannot move or speak, although they may be able to communicate with blinking eye movement. Okay? This is the most sad. Wait. Okay. What about posterior inferior cerebellar artery tract, or which is called Wallenberg or lateral medullary syndrome? There is difficulty in swallowing. There is dysphagia, dysarthria, inability to speak, dysphonia, ataxia, weakness, ipsilateral Horner syndrome, such as meiosis, anhidrosis, and partial ptosis, contralateral deficit in pain and temperature from body, and ipsilateral deficit in pain and temperature from face, vestibular system, vomiting, vertigo, and nystagmus. Alright, thank you for watching.